My name's David Clune, originally from New Zealand. Moved to Australia about 35 years ago with 4 children, and I basically was a young man dying. I was in really bad health with hepatitis.
I'm Grace. I met Dave when I was 15. He was 16. Yeah, we've been together ever since.
I think I was around 21 or 22 years of age when I really got diagnosed to say I had hepatitis B. There was no mention of even hepatitis C at that stage. It was just talk about hepatitis B. It wasn't until later on that I found out that I had hepatitis C. The stigma was horrific. It was there straight away, like even with the first interaction I'd had with doctors and nurses.
Yeah, the stigma was horrific, really.
I actually ran into a young doctor at the hospital that I was getting treated in at New Zealand at the time. And he actually was sitting in on my clinic that day with the senior doctor. And that young doctor walked up to me and said, sorry to hear about your diagnostic, with the hepatitis and stuff like that. And he said, one day you're going to need a transplant. He said, I'll give you a little bit of advice. He said, we've just started a transplant clinic up in Brisbane. And if you might look at considering moving there, because you will never get a transplant here in New Zealand. So we basically went on a wing and a prayer. We left the country behind that we lived and our family that we loved. The biggest thing that I noticed was that the care was different. I went from a clinic that and doctors that really didn't know what to do with us to a clinic that embraced us. And when they embraced us, it reflected on my health and well-being. They included my family in my care. And by doing that, it made me get involved in my own health. And I learned through that good health care how to make good decisions. And by making those good decisions that I've made over the years, before I got my transplant and before I got treated for hepatitis, that's why I'm still alive today. One of the biggest tips I could give anyone is get a good doctor, someone you're comfortable with and understands a little bit about your journey.
And everybody's journey is different because we're all different. You've got to find what's going to work for you.
Things have changed a lot from the days that I got diagnosed in the 80s.
It's a lot more support now than what there used to be.
Don't be stubborn like I was in the early days. The support turns you around and you'll be amazed what support you can get now today. It's there, it's free.
I found the biggest thing that helped me was asking my doctor to refer me to somebody, a psychologist, and being able to talk to someone else and just get it out. Let them help you understand different things. That's the big thing.
We need to focus on person-centered care. When you practice person-centered care properly, you get wonderful results. You look at my own journey. I was taken out of my home at 10 years age under the care of the state. I went through about 9 to 10 different homes in the next 5 years. I was sexually, physically and emotionally abused. Grace and I met at 15 and 16 years of age. I'd been put in an adult's prison. I was put in a psychiatric hospital and I was just bashed. And by the time we met at 15 and 16, I was basically flipped out and hung out to dry. And not long after that, I got diagnosed with hepatitis, right? Starting a family. And then the stigma come in. So I carried, in those days, we carried all that with us on our journey. Never goes away, that stuff. Never. We carried it right up until we got into our 50s. After transplant, not once in that time had anybody ever asked Grace and I about our well-being. Doctors and nurses that have been treating us for nearly 30 years. didn't ever know till recently what we've been through. We just need to make sure that people that are getting diagnosed have that support in place.